Hey guys. Okay, so it looks like it's 12:30, so I'm going to go ahead and get started. Today we just have two chapters to get through in community. So there's one about genomics in public health nursing, and then one about epidemiology. So let's see what we can do with those. Um, my hope is after I give you some of this information, maybe we could do something different and do like a case study or something together because this class is just something. All right, let's start with this chapter 11. Okay. All right. So when we talk about genomics, genomics examines the molecular mechanisms and interplay of genetic, environmental, and cultural and psychosocial factors in disease. So genomics deals with the functions and interactions of all genes in an organism and is the study of the total DNA structure. So it also talks about some of these other things up the top here. So genetics is going to be your study of the function and effect of single genes that are inherited by children from their parents. So for instance, if you were trying to see if someone was going to inherit Huntington's disease or something from their parents, you could look at their genetics and see and figure that out. Every nurse needs to become knowledgeable about genetics and genomics and their effects on populations because you can actually help patients that way if you know a lot of stuff about that. All right, so they do go into this brief little history about science. So the concept of this hereditary information began with agriculture back in the 18th century by George Mendel. So he was an Austrian monk who is usually considered to be the father of genetics. So at about the same time, Charles Darwin expounded on these theories of evolution, and Darwin's cousin, Francis Galton, performed family studies using twins in an effort to understand the influence of heredity on various human characteristics. Then in the 50s, a major breakthrough occurred in Cambridge, England, when James Watson and Francis Crick announced that they had figured out the structure of deoxyribonucleic acid, or DNA, and that this double helix structure could unzip to make copies of itself, confirming that DNA carries life's hereditary information, or the secret to life. So back in like the late 80s, they came up with this Human Genome Project. So this is an international genome project funded by the US Congress, and it was actually completed in 2003. So what it did was it mapped out all of the approximately 25,000 genes in human DNA. So most of the 0.1% of genetic variations are found within and not among populations. So these findings have implications for public health with this emphasis on public health. So I think it's just amazing that they even did that in that short period of time. That's a lot of work to do. Okay, so this is just a bunch of definitions on this slide. So when we talk about DNA, we're talking about deoxyribonucleic acid. It's a chemical inside the nucleus of the cell, and it has genetic instructions for making living organisms. DNA can be compared to long-term storage or a blueprint or code to construct other components of cells, such as proteins or RNA molecules. Then when we talk about genes, genes are the DNA segments that carry genetic information. Chromosomes are long structures that organize DNA. And when we talk about DNA replication, this means that chromosomes are duplicate before cells divide. There are 4 bases of DNA. So DNA is made up of adenine, which is your A, guanine, which is your G, and cytosine, which is your C, and thymine, which is T. So genes are comprised of specific sequences of these bases. And like say, if you have maybe A, C, T, G, that's a certain sequence that might mean something, whereas if you had a different sequence, it might mean something else. Mutations. So mutations are alterations in the usual sequence of bases that form a gene or changes in DNA or chromosomal structures. So typically when we see like medical problems with people, like say maybe it's cystic fibrosis, if you're looking at that, maybe there's just like a genetic mutation that happened, and instead of having that normal sequence in your DNA, it changes a little bit, and that's why they are sick or the way that they are. All right, and then the last thing here is called DNA repair. So process in which mutations are corrected. The estimates indicate repair mechanisms correct at least 99.9% of initial errors. So that's kind of cool that our DNA can actually repair itself. And it makes you wonder why it doesn't do it all the time, in certain instances. So this is kind of an interesting topic in a way. Okay, so what do you call the study of individual genes, including the mapping of genes and sequencing of DNA? This is genomics. And then again, this just kind of reviews what we learned a few slides ago, talking about genetics and genomics. Okay, so the next few years, we'll see an explosion in the number of DNA tests driven by information generated from the Human Genome Project. Improved technology will make DNA testing more accessible. These advances in genetics and genomics will necessitate that nurses continue to learn about this area of science to respond effectively to the challenges of this new knowledge. So I don't know if you guys have seen like previews on TV or anything, but they have this show, I'm trying to think, I don't know what the heck channel it is, but this lady, she looks at people's DNA and she helps them find, like to solve cold cases. And so you're kind of using this type of technology by, she like looks at their genealogy and stuff and tries to figure things out that way, but it's just kind of interesting. All right, so on this slide, it also says some indications for DNA testing might be, maybe you're trying to predict the development of a genetic disorder, so again, hey, maybe I want to see if my kid is going to have cystic fibrosis. Another reason is just to screen populations for certain, issues, and then also confirming a clinical diagnosis. Prenatal testing, that's a big one. So like think of our other class, and if you had a pregnant mother who had issues with a couple other kids and now she's worried that this one might have it, so you would do some testing to see if that's going to be the case. Development of individualized medical treatment. That's kind of exciting. So maybe you use DNA testing to like really individualize medicine and try and make it more specific to a certain person. All right, so current issues in genetics and genomics. So some of the things they talk about is it's a multifactorial influence. So, factors acting together that typically influence disease risk, health conditions, and the therapies used to treat disease. They often have a genetic or genomic element. They're influenced by the environment, lifestyle, and other factors, and they tend to run in families. There are multifactorial diseases, those that are caused by a gene and environment interaction. Some examples of multifactorial disorders would be things like neural tube disorders, cleft lip or cleft palate, congenital heart disease, type 1 diabetes, lung cancer, rheumatic heart disease, multiple sclerosis. Like there's 3 million things I could name off here. So there's a ton of things that are affected by the environment and the gene you know change in itself. Okay. Um, so in 2009, they passed this thing called the Genetic Information Non-Discrimination Act. So it's designed to prohibit improper use of genetic information in health insurance and employment. So in other words, if you had some kind of genetic thing wrong with you, it prohibits your employer from discriminating against you because of that. It places broad restrictions on the employer's deliberate acquisition of genetic information, so they shouldn't be allowed to get that information unless it's absolutely necessary. And it mandates confidentiality of that genetic information, so you have to keep that. And then it strictly limits disclosure of such information, so you can't disclose it to other people. And it prohibits retaliation against employees who complain about genetic discrimination. So you wouldn't want someone retaliating because of that. All right, so this is the stuff that I think is kind of interesting when we talk about genetics and genomics. This personalized healthcare. So genomics will enable medicine to be tailored to each person's individual needs. So there is something called the Personalized Healthcare Initiative. This was instituted by the USDHHS, which this initiative includes these goals. So they want to link clinical and genomic information to support personalized healthcare. They want to protect individuals from discrimination based on unauthorized use of the information, like we were just talking about. They want to ensure the accuracy and clinical validity of genetic tests performed for medical application purposes. And then they want to develop common policies for access to genomics databases for federally sponsored programs. Just imagine that, like, say you go in and, I don't know, you find out you have hypertension or something, and they have to, put you on medicine for your hypertension, but then they talk to you about how you have to be on a special diet now. So with some of this kind of information, you can really personalize what kind of things this person should be doing as far as diet and exercise. Like you could personalize what you tell them instead of just our normal everyday thing we tell everyone. Because maybe this person has more of a, maybe they would do better with a certain type of exercise compared to someone else. Or maybe they would do better eating certain nutrients compared to other things. So you can tailor it right to their needs. So there is also, so the slide talks about evaluation of genomic applications and practice and preventing working groups. So this supports the development of a systematic process for assessing the available evidence regarding the validity and utility of rapidly emerging genetic tests for clinical practice. So it reviews the CDC commissioned evidence reports and other contextual factors, and it highlights critical knowledge gaps. It provides guidance on appropriate use of genetic tests in specific clinical scenarios. Okay, so there should be some certain genomic competencies for public health workforce. So public health workers should be able to do the following. They should be able to demonstrate basic knowledge of the role that genomics plays in the development of disease. They should be able to identify limits of their genomic expertise and make appropriate referrals to those with more expertise in that. So I guess back in 2004, this National Coalition for Health Profession Education and Genetics came up with these core principles that everyone should know about. So those principles included biological variation, cell biology, classical Mendelian genetics, molecular genetics, development, and new genetic technology. So those are the core principles that they say that people should be up on if they're going to have anything to do with genetics, when they're taking care of patients. All right, so this is talking about incorporating these things into public health nursing practice. So the advances brought about genomics, however, they're changing our perceptions as this knowledge will enable health promotion and disease prevention programs to be specifically directed at susceptible individuals and families or at subgroups of the population based on their unique genomic risk profile. So in other words, you can make this risk profile for certain people to say, oh, well, these guys are at risk for heart disease. So I want to, do this, this, and this for them. So by knowing their genetic makeup, you can really do a lot with prevention. So the public is beginning to expect that all nurses will use emerging genetic information and technology in their practice, in research, and in all forms of health education. So the Nursing Code of Ethics include the right that people have to seek and receive genomic health care that is non-discriminatory, confidential, private, and that enables those served to make informed decisions. The International Society of Nurses in Genetics advocates for nurses at both the basic and advanced practice levels to be able to deliver genetic nursing care. Okay, so the registered nurse will do the following. So they should demonstrate an understanding of the relationship of genetics and genomics to health, prevention, screening, diagnostics, prognostics, selection of treatment, and monitoring of treatment effectiveness. The nurse should be able to demonstrate the ability to elicit a minimum of 3-generation family health history information. They should be able to construct a pedigree from collected family history information using standardized symbols. They should be able to collect personal health and developmental histories that consider genetic, environmental, and genomic influences and risk factors. They should also be able to critically analyze the history and physical assessment findings for genetic, environmental, and genomic influences and risk factors. They should be able to assess patients' knowledge, perceptions, and responses to these things, and also develop a plan of care that incorporates genetic and genomic assessment information. All right, so when it talks about identification, so the registered nurse will identify clients who may benefit from specific genetic and genomic information or services based on assessment data. They should identify credible, accurate, appropriate, and current genetic and genomic information resources, services, or technologies specific to given clients. They should identify ethical or ethnic, ancestral, cultural, religious, legal, fiscal, and societal issues related to genetic and genomic information and technologies. And then they need to be able to define issues that undermine the rights of all clients for autonomous, informed, genetic and genomic related decision making and voluntary action. All right, so the RN would be able to facilitate referral for specialized genetic and genomic services as the client needs them. So in other words, like say I'm a mom and I'm getting tested to see if my baby is going to have Huntington's disease or something like that. So if you do the testing and you find that, yes, they're going to have this, then you need to have more counseling and things that you do with the family to be able to figure out where to go from there. Are they going to let them continue to progress in the pregnancy? Or are they going to terminate the pregnancy? Are they going to, do they understand all of the responsibilities that they're going to have in taking care of a patient that has this, you know? So that's the kind of stuff you need to think about with referrals. Okay, so then this talks about provision of education, care, and support. So the registered nurse should be able to provide clients with interpretation of selective genetic and genomic information or services. They should be able to provide clients with credible, accurate, appropriate, and current genetic and genomic information, resources, services, or technologies that facilitate their decision making. They should be able to use health promotion disease prevention practices that consider genetic and genomic influences on personal and environmental risk factors. They should be able to incorporate knowledge of genetic and genomic risk factors, use those interventions and information to improve client outcomes. They should be able to collaborate with healthcare provided in providing genetic and genomic healthcare. Also collaborate with insurance providers and payers to facilitate reimbursement for some of these things. Perform interventions or treatments appropriate to clients that have some of these healthcare needs, and then evaluate the impact effectiveness of genetic and genomic technology, information, interventions, and treatments on client outcomes. Okay, so they talk about mapping out a pedigree. Have you guys ever done that before in the past? Do you know what I'm talking about when I say that?
Yes.
Yes. Okay, so I don't know if everyone knows. Let me see if I can, let me see if I can do something different here. I don't know how good this is going to work. I'm going to try it. So here's my whiteboard. So if I was doing a pedigree about something, like I remember my kids had to do this in science class in school. So they had to ask everyone in the family like what color eyes they all had. And then they did some kind of pedigree where they went back 3 generations if they could. And you know, when you do a pedigree, it's just like a family tree in a way. So like say, you know, you put a box here, you know, like maybe this is the father, this is the mother. And like you go and you like maybe the father has blue eyes. So you would put a certain symbol in that, you know, like, I don't know, maybe it's a circle or whatever. And maybe the mother has green eyes. So that's a different symbol. So I don't know, maybe triangle or something. I don't know. So as you go on through your family tree and like draw out your family tree, you do these symbols, you know, for those different characteristics that you're looking for. And so the idea then with the pedigree is you can find out how things are getting passed down through generations. So like you might say, oh, well, it looks like only on the father's side he passed down this, this, and this. Or maybe it's both, you know, maybe it's mother and father that passed it down. So you can kind of tell by looking at everything. So a pedigree is just drawing a family tree used by medical professionals and genetic counselors to assess families and look for patterns that may be helpful in diagnosing or managing a person's health. So certain red flags that you would watch out for when you're looking at a pedigree. So if you see a family history of multiple affected family members with the same or related disorders, which may or may not follow an identifiable pattern in the family, that's a red flag. Onset at an earlier age than expected. So like you could get into a lot of detail here about like people's ages and stuff too. Let's see. Also a condition occurrence in that gender that is least expected to have it. Disease occurrence in the absence of known risk factors. And then also ethnic predisposition to certain genetic disorders, that would be a red flag. And then close biological relationship existing between parents. So that would be another red flag. If I can get back here. Okay, so nurses must stay current with ongoing discoveries in literature. In order for people to benefit from widespread genetic and genomic discoveries, nurses must be competent to be able to obtain comprehensive family histories, to identify family members at risk for developing a genomic influence condition, or even genomic influence drug interactions. We also should help people make informed decisions about and understand the results of their genetic and genomics tests and therapies. And then also refer at-risk people to appropriate healthcare professionals and agencies for specialized care. So that's kind of the gist of this chapter. It wasn't too long. Let me see if I can find something I want to show you guys. One second. All right, let's see if we can do this. Let me share this real quick. All right, this is something from our book that's like a case study, and then it has questions and answers with it. So in this case study, it says we have this person who's a nurse, Aiden A. They volunteer at a local medical mission for an impoverished neighborhood in the community. Mary and her husband come to the clinic and ask Nurse Aiden about genetic testing for colon cancer. Mary is a 40-year-old woman who has not had any serious or chronic medical problems in her lifetime. Mary's interested in getting tested because her sister was diagnosed at age 31 with colon cancer and died 7 months after she received the diagnosis. Mary has waited 5 years to pursue getting tested or screened. Nurse Aiden took a thorough family history for Mary and learned that she is the mother of 2 children, a 16-year-old daughter and a 12-year-old son, and that Mary's mother had endometrial cancer at age 45. Mary's maternal aunt is a survivor of cancer of the small bowel. Nurse Aiden recognized that Mary is at increased risk for hereditary non-polyposis colorectal cancer. Nurse Aiden was able to refer Mary for genetic testing and scheduled her for a colonoscopy screening. The genetic test indicated that Mary does carry a gene alteration causing HNPCC, and her colonoscopy showed a healthy bowel free of polyps. Armed with this knowledge, Mary follows her healthcare provider's advice and plans to have a colonoscopy every year and will be screened for endometrial cancer. So what are the steps Nurse Aiden should do to help Mary complete a family health history? What would you guys do there?
Tell her to go back at least 2 or 3 generations
Okay.
for like any major health problems.
Yeah. So sometimes the problem with this, when you try to do a family history, a lot of people don't know their family history, like they don't know about their great grandparents or whatever, and you have a hard time getting a decent family history. Any other thoughts? All right, so this is saying here, When you do a family health history, you should explain to the family what it is and encourage the family to develop a 3-generation history of biologic relatives. So, meaning people that are you're related to, not like from marriage or anything. Explaining that this type of history is a useful tool to help them determine their health risks and prevent disease in themselves, and encourage the family to update the document regularly. So it's kind of a neat thing. If you actually had one done and you kept up with it and kept updating it, it would be a nice thing to pass down to other people in your family. Okay, so what are some genetic red flags in Mary's family history?
All the cancers.
Yes, for sure. It's how many different kinds of cancer does she have in there? It seemed like a lot.
Yeah, it was like 3 or 4, I think.
Yeah, yeah. Anything else that jumped out to you about that?
They're all colon related.
Okay. It seemed like they all were young when they got it too. Because if you look back up here, it looks like, let's see, her sister was diagnosed at 31, Mary's 40 herself, and then I think her mother got her cancer at 45. So they're all pretty young, you know? So that would probably be another red flag. All right, so down here it says Mary's family history noted multiple family members with the same or related disorders. And an onset of the disease was at an earlier age than expected. Other genetic red flags not included in the case study would have been this. So disease occurrence in the absence of known risk factors, and then ethnic predisposition of certain genetic disorders, and then also close biological relationship existing between parents. That would be another one. Okay, so now that Mary is more aware of her risk, what advice should Nurse Aiden provide for Mary's children? What would you say to the children?
That they should be aware and get their genetic testing once they like reach a certain age.
Okay. Anything else?
Maybe talking to like their start having like a colonoscopy or whatever, since it
Yeah.
seems to all be colon related.
Yeah. So sometimes, you know, we have these like recommendations that we tell people, oh, get a colonoscopy by age whatever. But if you have things that run in your family and it tends to happen quicker, then you need to get some of that stuff done earlier, you know? So that would be something else to think about for sure. So this is just saying you should educate the children about, you know, her specific issue, HNPCC, and the genetic tests available for it. You can encourage her children to consider getting genetic screening to see if they have inherited that gene as well. And then Mary's children should also begin regular colonoscopy screenings as young as age 20 because everyone gets it so early in their family. So that's that. Let's see. Let me see if we can, let's try this too. Let me look at this and see if this is worth it or not. Maybe. Let's try this. All right. All right, some of these you're just going to see the answer right away because of the way this prints out. But okay, so new discoveries in molecular genetics will have the greatest effect on nursing practice in the area of, and you would say, collection and use of health histories. So this says the profession of nursing will be impacted by new discoveries in molecular genetics in education, practice, and public health debates. So when you're doing someone's health history, it can affect a lot of different things that you do in the future. Okay, in the late 1950s, Down syndrome was discovered to be caused by an extra copy of chromosome 21. This early breakthrough best describes, what would you choose? Sorry, I don't know if I heard what you just said. Did you say something?
No.
Oh, okay. Anyone have a guess? So this answer would be B, genetics. So remember when we talk about chromosomes and all of that, that is going to talk about, um, the gene that carries certain things. So the term genetics means the study and function of effect of single genes that are inherited by children from their parents. So um, genomics refers to the study of individual genes in order to understand the structure of the genome. Let's see if there's another one here. Here we go. The overarching themes conceptualized in the vision of the Human Genome Project embrace the relationship of genomes to what?
B.
Let's see. Yes, you're right. Good job. And I can send you guys a copy of these too. I'll see if I can do that in email when class is done. I don't know if maybe these might help you for testing or whatever. All right, let's do one or two more and then we'll move on. Okay, a young female client is concerned about her risk for developing ovarian cancer and needs information that might affect her health decisions. She requests that her elderly grandmother be tested for genetic mutations. One specific challenge faced by a family member in responding to such a request is,
A.
let's see, B, carrier guilt. All right, so this just says, actually it says a lot. Okay, so genomics has influenced the availability of genetic tests, which has implications for families. So individuals, families, and communities need to understand the purpose, limitations, and potential benefits and risks of tests before submitting samples for analysis. Um, a lot of times when people have it already and they want the rest of their family to get tested, they feel guilty because they were, the person that kind of started it all. Okay, one more here. Cleft lip and or palate, a common congenital malformation, is often inherited and influenced by environmental factors. Therefore, it is referred to as a
D.
Yeah, I think you're right. Yeah, multifactorial disease. Good job. All right, like I said, I'll send this to you guys later on. There's more. I think there's like 10 questions on here or something. All right, let me get our other PowerPoint here. Okay, so this one's about epidemiology. So epidemiology is considered the basic science of public health. So nurses will use epidemiologic frameworks, methods, and data to better understand factors that contribute to health and illness, to develop health promotion and disease prevention interventions and measures, and then also to identify the presence of infectious agents in individuals and groups. They also want to be able to design, implement, and evaluate community health programs, and then also develop and evaluate public health policies. All right, so this also starts with a few definitions, so we'll kind of get that out of the way first here. So when we define health, it's defined as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's a fundamental human right, and the attainment of the highest level of health is the most important worldwide social goal. And then nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Then when we talk about public health, that is going to be described as a system and social enterprise, a profession, a collection of methods, knowledge, and techniques, governmental health services, especially medical care for the poor and underserved, and the health status of the public. And again, more definitions. Okay, so we already kind of defined epidemiology. It's the study of the occurrence and distribution of health states or events in specified populations, including the study of the determinants influencing such states and application of this knowledge to control health problems. All right, and then when we say descriptive epidemiology, this means we're seeking to describe the occurrence of a disease in terms of person, place, and time. Determinant is factors, exposures, behaviors, contexts, and characteristics that determine or influence the patterns of why and how. They may be an individual, relational, social, communal, or environmental. Analytic epidemiology. So this is going to be focused on investigation or causes and associations. Ecological approach is the broad consideration of many levels of potential determinants. When we talk about distribution, this is to determine who has the disease and where and when it occurs. And then epidemic, we kind of all are familiar with that right now. This occurs when the rate of disease, injury, or other condition exceeds the usual endemic level of that condition. Okay, so this gets into a little history again. So it says back in the 4th century, Hippocrates maintained to understand health and disease in a community, one should look to geographic and climate factors, the seasons of the year, the food, the water consumed, and the habits and behaviors of the people. Also, refinements in research methods in the 18th and 19th centuries were critical to the formation of epidemiologic methods. So one of those things was use of a comparison group. Another one was development of quantitative techniques, and things like numeric measures or counts. And then by mapping cases that clustered around a single public water pump in one London cholera outbreak, this guy named John Snow demonstrated a connection between water supply and cholera in the mid-19th century. So like you can see, we have come a long way. In the 20th century, dramatic changes are happening with life expectancy, and there's an increase in chronic diseases. So some of the things that we look at specifically with epidemiology are morbidity and mortality rates. We look at, there's like a triangle, and I think it shows it on the next slide. There's a picture of it, but it talks about the web of causality and the ecologic model. And then we look at social epidemiology, and then also levels of preventative interventions. Okay, so when we measure morbidity and mortality, so this is some of the things we need to think about when we're talking about that. So a proportion is a type of ratio in which the denominator includes the numerator, often expressed as a percent. A rate is a measure of the frequency of a health event in a defined population, usually in a specified period of time, a measure of how rapidly something is happening. Risk refers to the probability that an event will occur within a specified period of time. And then this mentions incident rate. An incident rate will quantify the rate of development of a new case in a population at risk, whereas an incident proportion indicates the proportion of the population at risk who experience the event over some period of time. Prevalence proportion. This is a measure of existing disease in a population at a particular time. So the number of existing cases divided by the current population. And attack rate. This is defined as the proportion of persons who are exposed to an agent and develop the disease, and is often specific to an exposure. Mortality rates. So these are informative only for fatal diseases and do not provide direct information about either the level of existing disease in the population or the risk of contracting any particular disease. Many commonly used mortality rates are in fact proportions, not true rates. They are calculated for specific groups, and there's something called a case fatality rate. This is the proportion of persons diagnosed with a particular disorder who die within a specified period of time. And then the last one is proportionate mortality ratio. This is a proportion of all deaths that are attributed to a specific cause. All right, and then back in the previous slide, I was telling you there's like a triangle, an epidemiologic, I can't say it, epidemiologic triangle. This is it here. So this model was originally developed as a way to identify causative factors, so transmission and risk related to infectious diseases. Changes in one of the elements of the triangle can influence the occurrence of disease by increasing or decreasing a person's risk for the disease. Specific characteristics of the agent and host, as well as interactions between agent and host, are influenced by the environmental context in which they exist and may in turn influence the environment. The agent could be infectious, it could be a bacteria, a virus, a fungi, or a parasite. It could be chemical, so it could be heavy metals, toxic chemicals, pesticides. It could also be physical, so it could be radiation, heat, cold, machinery, something like that. So that's the agent. The host is, when you're looking at the host, you're looking at genetic susceptibility. You're looking at immutable characteristics, meaning things that they can't really change, like age and sex. You're looking at acquired characteristics, like their immunologic status. Lifestyle factors, like how much, what their diet is like, how much they exercise. And then when you're looking at the environment, we are talking climate, like temperature, rainfall. We're looking at plant and animal life, so agents and reservoirs or habitats for agents. We're looking at the human population distribution. So crowding, or if there's social support, we're looking for socioeconomic factors, education, resources, access to care. And then we're also looking for working conditions, levels of stress, noise, and satisfaction. All of those play a part in epidemiology. All right, so the web of causality. So this is a two-dimensional causal web that considers multiple levels of factors that affect health and disease. It looks like a spider web, and this person named Krieger back in 1994 suggested that in addition to research on the relationships within the web, we need to look for the spider. That is the focus on those larger factors and contexts that influence and create the causal web itself. All right, then we have the ecologic model. So this approach expands epidemiologic studies both upward to broader context, such as neighborhood characteristics and social context, and downward to the genetic and molecular level. Like the web of causality model, the ecologic model recognizes multiple determinants of health and treats them as interrelated and acting synergistically or antagonistically, rather than as a list of discrete factors. So the ecologic model spans a broader spectrum of systems and etiologic factors than more traditional web of causality model, and encompasses determinants of many levels: biologic, mental, behavioral, social, and environmental factors, including policy, culture, and economic environments. So another way of thinking of this is that the ecologic model moves from a two-dimensional perspective to a multi-dimensional perspective. So this kind of takes more things into account. Okay, which study model expands epidemiologic studies both upward to broader context and downward to the genetic and molecular level? What did we just talk about? Ecologic model. And again, they're just reviewing what we talked about before with the ecologic model right here. Okay, so the next thing talks about social epidemiology. So this focuses on roles and mechanisms of specific social phenomenon. So it looks at social inequalities and data related to neighborhoods, communities, employment, and family conditions to analyze health issues and to design appropriate and feasible public health interventions. So we have talked before, I believe, about primary, secondary, and tertiary, things to do. So this is levels of prevention now. So primary prevention, this is going to refer to interventions aimed at preventing the occurrence of a disease, injury, or disability. So interventions at this level are aimed at individuals or groups who are susceptible to disease but have no discernible pathology. So they're not sick with it yet, but they may be susceptible to it. So an example of this, counsel clients about low-fat diet and regular physical exercise. That would be a primary prevention thing to do. Secondary prevention. This looks at interventions designed to increase the probability that a person with a disease will have that condition diagnosed at a stage when treatment is likely to result in a cure. So now this person may already have something going on, but you want to catch it early so that you can do something so it doesn't progress and get worse. So for example, blood pressure and cholesterol screenings. So maybe you do a treadmill stress test or something. And then tertiary prevention. So this includes interventions aimed at disability limitation and rehab from disease, injury, or disability. So for example, you want to provide cardiac rehab or medications or surgery. So now in this level, you try to do things to make them more functional, I guess you could say, so that, they already have a certain problem going on, but you're trying to um, make them so they're not so dysfunctional, I guess you can say. All right, this is an intervention spectrum. So multi-level interventions in healthcare across the cancer care continuum is what this is looking at. So when you're looking at this, they go from prevention to treatment. So, prevention starts with pre-intervention, basic and clinical sciences. They look at risk factors and causality. Then they look at universal, selective, indicated. And then it goes a little further. It goes, okay, now comorbidity prevention, disability prevention, relapse prevention, maintenance treatment, and then acute care. Okay, so when we talk screening, this is testing of groups of individuals who are at risk for a condition. Maybe they're asymptomatic. It's really not a diagnostic test, but it's a key component in secondary prevention. So if you're going to do screening, you want to make sure it's reliable and that it's specific to what you're trying to test for. So the precision or reliability of the measure, its consistency or repeatability, and its validity or accuracy, and how exact the measurement is are important considerations for any measurement. Validity is a screening test and is measured by sensitivity and specificity. Sensitivity quantifies how accurately the test identifies those with a condition, and specificity indicates how accurately the test identifies those without the condition or trait. The positive predictive value is the proportion of persons with a positive test who actually have the disease, interpreted as probability that an individual with a positive test has the disease. The negative predictive value is the proportion of persons with negative tests who actually are disease-free. All right, so then this gets into a little bit about surveillance. So this is the systematic collection, analysis, and interpretation of data related to the occurrence of disease and the health status of a given population. So you can have active or passive symptoms. So for surveillance, we do this now with the coronavirus. So we already know there's a lot of people who have it. So we collect data about it all the time so we could see how we're doing, if it's getting better or getting worse. So passive surveillance is a more common form and is used by most local and state health departments. Active surveillance is the purposeful ongoing search for new cases of disease by public health personnel through personal or telephone contacts or the review of lab reports or hospital or clinic records. So active surveillance would be you're looking a little bit more closely into certain other things to see if you can find out more about more people who might have it. So some of the methods we use in epidemiology would be, collecting data from different sources, right? We also want to look at comparison groups and the rate adjustment as well. So with some of the data that we collect, certain things that we might use would be things like census data, vital records like birth and death certificates, surveillance data as carried out by the Centers for Disease Control and Prevention. And then data collected for other purposes is useful for epidemiologic research. So maybe medical health department insurance records, something like that. So those are some examples of some of the types of data that we would get. All right, and then when we talk about rate adjustment. So rates can be misleading. For example, the risk of death increases rather dramatically after 40 years of age. Therefore, a higher crude death rate is expected in a population of older people compared with a population of younger people. So there's age adjustments that you might do. So there's a direct method and an indirect method. So the direct method is a direct age adjusted rate applies the age specific death rates from the study population to the age distribution of the standard population. The results is, the death rate of a study population if it had the same age distribution as the standard population. So for the indirect method, so the age-specific death rates of the standard population apply to the study population's age distribution, and that's used with the crude rates of both the study and the standard populations to produce the final indirect adjusted rate. The indirect method may be required when the age-specific death rates for the study population are unknown or unstable. All right, and then this talks about comparison groups. So in the absence of the ideal, researchers either randomize people to exposure or treatment groups in experimental studies, or they select comparison groups that are comparable in observational studies. Advances in statistical techniques now make it possible to control for differences between groups, but these advanced techniques are effective only in reducing the bias that results from confounding by measured variables. All right, we're almost done, guys. So now this gets into a little bit about descriptive epidemiology. So remember, we're looking at person, place, and time. So this describes the distribution of disease, death, and other health outcomes in a population according to person, place, and time, providing a picture of how things are or have been, the who, the where, and the when of the disease pattern. Personal characteristics of interest in epidemiology include race, ethnicity, sex, age, education, occupation, and income, and also marital status. As noted previously, the most important predictor of overall mortality is going to be age. When considering the distribution of disease, geographic patterns come to mind. So you might say, does the rate of disease differ from place to place? In relation to time, epidemiologists ask three questions. Is there an increase or is there a decrease in frequency of the disease over time? Are other temporal patterns evident? Temporal patterns of interest to epidemiologists include secular trends, point epidemic, cyclical patterns, and event-related clusters. And then long-term patterns of morbidity and mortality rates are called secular trends. Secular trends may reflect changes in social behavior or health practices. One temporal and spatial pattern of disease distribution is the point epidemic. In addition to secular trends and point epidemics, there are also cyclical time patterns of disease. One common type of cyclical variation is the seasonal fluctuations seen in a number of infections or illnesses, like, for example, the flu. A fourth type of temporal pattern is non-simultaneous event-related clusters. These are patterns in which the time is not measured from fixed dates on the calendar, but from the point of some exposure or event, presumably experienced in common by affected persons, although not occurring at the same time. All right, and then analytic epidemiology. So analytical epidemiology, on the other hand, searches for the determinants of the patterns observed, the how and the why. So ecologic fallacies are associations observed at the group level that may not hold true for the individuals who make up the groups or associations that actually exist. They could be masked in the group data. Oops. Okay. And then with experimental studies, we do clinical trials and community trials. Then this talks about causality. So you do statistical associations, you look at bias, and you assess for causality. So bias is a systematic error resulting from the study design and execution, or is confounding. So then the very last slide talks about community-oriented epidemiology. So this involves observation, data collection, consultation, and interpretation. So they talk about this lady, Lillian Mood, as an example. So Lillian Mood is a public health nurse with more than 20 years of experience in South Carolina. She worked with communities to detect and explain the cause of illness and disability. In describing her involvement with specific communities, Mood noted that the contact often began with a telephone call of concern about a planned or existing industrial facility, or firsthand observation of illness expressed in lay terms as too many cases of cancer, or several people have had miscarriages, or there's a lot of respiratory problems. The citizens' reasoning behind these observations is that if I'm seeing more health problems in my community, I ask what they have in common. The common factor may be where we live, so it must be either the air or the water. This is a basic epidemiologic thinking, not irrational fear. Citizens try to make sense of what they are seeing, and they want professional help to unravel the pattern of illness. So popular epidemiology is a form of epidemiology in which lay people gather scientific data as well as mobilize knowledge and resources of experts to understand the occurrence or distribution of a disease or injury. So I don't know if you guys have ever heard of someone like in a certain area where, you know, maybe they live near some industrial park or something, and they seem like they have a huge incidence of cancer deaths in their area, or there's a lot of people who die of, I don't know, certain things, you know, because of something going on in their area. So a lot of times when you really look, if you're a public health nurse and you really investigate to see what's going on, you can kind of come up with what's going on there. There was a movie that came out not too long ago that talked about, you know, there was a company that was polluting water in the area, and all these people were getting sick and stuff, and you know, there's a big cover up about it, and so they ended up figuring it out, and there's a huge lawsuit that came out about that. So that's kind of like what epidemiology is trying to figure out, you know, who, what, where, and why, you know, what's going on with a certain sickness in an area. Okay, let me see if we can do what we did before. Oops, I guess it logged me out. Let me get back in here. Okay, here's another thing, just like we did before. Let me see if I can share this so you can see it. Okay, so this is talking specifically about this chapter we just talked about. So Mary M. is the nurse epidemiologist for the Warren County Health Department. A local church contacted Nurse Mary when several church members became sick after the annual church picnic. Of 200 people who attended, 100 became ill with diarrhea, nausea, or vomiting. 10 people required emergency medical treatment or hospitalization. Incubation periods ranged from 1.5 to 30 hours, with a mean of 6 hours and a median of 3.5 hours. Duration of illness ranged from 1 to 80 hours, with a mean 30 hours and a median of 15 hours. The annual church picnic was a potluck lunch benefit. The menu included macaroni casserole brought by the Joneses, turkey and gravy and stuffing brought by the Smiths, potato salad brought by the Changs, green bean casserole brought by the Champs, chili brought by the Turners, homemade bread brought by Granny Ivy, chocolate cake brought by the Bushes, and cookies brought by the Beckmans. Nurse Mary interviewed the church members who were ill and found that 3 food items were significantly associated with the illness: the turkey, gravy, and stuffing. Nurse Mary interviewed the Smiths who brought the turkey, gravy, and stuffing to the picnic. A review of food handling procedures revealed that the turkey had cooled for 4 hours at room temperature after cooking, a time and temperature sufficient for bacterial growth and toxin production. Furthermore, the same utensils were used for the turkey and for other foods before and after cooking. Nurse Mary trained the Smiths in proper food handling practices, emphasizing hand washing, proper cooling methods, and better equipment and utensil sanitation. Nurse Mary also offered a similar class to other church people in the congregation. So identify the agent, the host, and environment in this case study. Any thoughts? All right, you guys, it's, the agent is the bacteria that grew within the turkey. The host are the people who ate the turkey, gravy, and stuffing because the bacteria got into them that way. And then the environment was the poor food handling conditions. So the turkey was left at room temperature for too long, and the utensils used to handle the turkey, which contaminated the gravy and the stuffing. Okay, is Nurse Mary performing descriptive epidemiology or analytic epidemiology?
I would probably say the analytic one. She was analyzing where it came from.
Yep, you're right. So analytic epidemiology, she's looking for the how and the why that it happened. Okay, which level of prevention is she exemplifying? You know how we talked about primary, secondary, tertiary?
Well, technically, it would be primary when she was like at the end when she was teaching other church congregations and stuff like that. That would be primary prevention.
Yeah, look at you. You're good. Yay. Okay, so primary prevention. So she's teaching people how to, handle food the right way so this doesn't happen again, to prevent future things from happening. And then it says she does not provide tertiary because she provides no treatment for those who became ill. And she doesn't provide secondary because she performs no health screening in the above case. Okay. So that's that one. And then let me see if there's a few questions we can do, and then we'll call it a day. Yeah, here we go. Okay, so this first one's just going to show you what the answer is, but which of the following article titles includes an example of epidemiologic distribution and determinants? So it's going to be comparison of post-insecticide exposure incidence of atopic dermatitis in migrant farm workers and land-owning farmers in southwestern Utah. So again, epidemiology investigates the distribution and determinants of health events in a population. So that's why you would pick that one. Okay, so this next one says a state public health region reported 39 cases of meningitis in children 15 years of age and younger to date this year. 7 of those children died. The total population of the region is 780,000, of whom 84,000 are children age 15 years old and younger. What is the prevalence proportion of meningitis in this region thus far in the current year? Any thoughts? So this is going to be C, 46 out of 100,000. All right, so it says down here, when you do this proportion thing, in this example, 39 cases divided by the total number of children aged 15 years and younger in the population, which is 84,000 children. So that's how they're getting that. Okay, and then this one is saying a state public health region reported 39 cases of meningitis in children 15 years of age and younger to date this year. 7 of those children died. The total proportion of the region is 780,000, of whom 84,000 are children. So it sounds just like the one above. 15 years old and younger. What is the age-specific meningitis death rate for children aged 15 years and younger for the region this year? This one's going to be A. I'll show you how they figured that out. So they say a rate is a ratio, not a proportion, because the denominator is a function of both population size and the dimension of time. So what you do is you take 7 children deaths divided by the total number of children aged 15 years and younger in the population, which is 84,000, and that's how you get that rate there. All right, and then number 4 says a state public health region reported 39 cases of meningitis, again, same thing, in children 15 years of age and younger to the date this year. 7 of those children died. The total population of the region is 780,000, of whom 84,000 are children 15 years of age and younger. Only 4 cases of meningitis were reported in the public health region during the previous year. No other public health region in the state has an increase of meningitis that is higher than the expected in that region. Based on the information given, the relative frequency of meningitis in the region at this time can be described as
Is it A?
B, epidemic. You're close. So an epidemic is when the rate of disease, injury, or other conditions exceed the usual level of that condition. All right, let's do one more. Okay, John Snow played a critical role in the development of modern disease surveillance when he did what?
I'm pretty sure it was D.
Yeah, I think you're right. Yep, you got it. All right, so I will send you the rest of these questions so you guys have those to look at. How's it going with your groups for your project, you guys? Are you coming into any issues or problems?
We're doing pretty good.
You're doing okay? Did you guys get your history of your town done yet?
Yeah. we did.
Yeah, I have mine.
Okay, if you guys have it done, email it to me so I can take a look and give you some comments, okay? I thought you guys did really well with your windshield survey stuff that you sent me. I thought that looked really good. So let's keep up with the good work and keep it going, okay?
Sounds good.
All right. I'm all done with class today. That's all we had for today, so we'll just call it a day now. I think I met with most of you for remediation for class. If there's anyone who still needed to remediate with me, if you want to do it after class here, I'm fine with that. I can meet with you. Okay?
Thank you.
All right, thanks, guys.
Thank you. Wait, is it
Did you want to do some remediation or you have time or no?
does it take very long?
Well, I mean, I got to do it for both classes with you, so are you in the hurry to do something else?
I just have to go drop something off at my parents' house, but they're in Medina and I'm not.
Okay. How long does it take you to do?
I'm not sure if I'll stay or not, but I'm supposed to have class till 3:20 anyways.
Well, let's see if we can just get it done, okay? All right, let's do this class first since we're in this class. So let me pull up your thing real quick. Since we're here, we might as well get it done, right?
Yeah.
All right, let me see if I can pull this up. Okay, this is your test right here for this class. So we'll go through and see what you missed and go from there. So you started out really good. Okay, so number 6 here, it says, which topic is most likely to have been discussed when Lillian Wald provided public health education? So she's all about educating the community on sanitary practices and stuff. So it would be safe and sanitary baby and child care.
Makes sense.
Okay, this one here, this is talking about investigating environmental health problems caused by contaminated groundwater. This is best describing as practicing what? So you had community-oriented nursing, community-based nursing, policy development, and community-oriented nursing. Or wait, tertiary care is the last one. So, do you understand what policy development is?
Yeah, I think I was just confused on that question. Because going back, that makes sense. Now that I know the answer, it makes sense. But I really didn't know what to put for that one because I mean it didn't really seem like policy development, but I wasn't sure.
Okay. So when we do policy development, we're trying to, make some kind of policy or procedure that is going to be in place so that something is better for next time. So like for this, it says you're investigating environmental health problems caused by contaminated groundwater. So you're looking into it more. So you're not really making anything different, So the other stuff like tertiary care, I wouldn't pick that at all. But, I guess, yeah, if you didn't know, you just didn't know, but I'm
Yeah,
just saying.
it's one of those ones.
All right, what else here? Okay, this one, collecting data and monitoring the health status of the population defines which are the core public health functions. So this is almost like the nursing process. If you're collecting data, right, you're doing assessment, you're collecting data.
Yeah. I think I overthought it.
Okay. What else? Okay. Which of the trends in health issues in the United States between 1900 and 1955 is accurate? This was the rise in chronic diseases such as heart disease and cancer. And that's, some of this is just like, memorization type stupid stuff. Okay, so this one here, you're caring for a client who was prescribed an antidepressant and recommended to attend counseling sessions for his recent diagnosis of depression. This is an example of, so when you're talking primary, secondary, tertiary,
Is it tertiary?
so primary means that you don't have any issue yet, but you're trying to prevent it from happening. Secondary means that you may have it already, but you're trying to like catch it early so that you can do something about it and like get on the right meds and be, do well. Tertiary means that you already have it, you have some type of disability from it, and you're trying to maybe do rehab or something along those lines to fix it better so you're more functional. Does that make sense?
Yeah.
Okay. All right. Population focused practice, we did that. Okay, how about this one? Which statement requiring poverty and health insurance is true? So it should have been millions of people in the United States are without health insurance. That's
Yeah, I
kind
was
of,
between those two because I was like, eh.
yeah, I mean, it's kind of hard to believe that anymore in 2020, but you have to remember our book's a few years old,
Yeah.
so back then maybe that was true, but maybe not as much anymore. And I mean, there are still people without health insurance out there.
Right.
Okay, Florence Nightingale's contributions to public health were, correct answer is supposed to be using a population-based approach that led to improved environmental conditions.
See, I think like even like the thing you sent us, I think the like answers, quote unquote answer that I found for that wasn't even right. So that was because I think I put like she founded the first nursing school or something.
Well, yeah, I mean, she did, but what does that have to do with public health?
Yeah, that's why I didn't really know. Yeah.
Yeah, so when you think about Florence Nightingale and you think about public health, you should think about, back when in the Crimean War, when she was, helping take care of people during the war, she saw all kinds of really bad conditions and no one was doing any kind of sanitary anything. And so she's like, oh, well, maybe if I wash my hands, this person's wound won't be so bad if I do that from now on, So she's the one that kind of came up with all of that kind of stuff because of what she saw happening. So that's kind of like what she's famous for is that. Okay, what else? Okay, and these select alls, if you miss one, whatever, you had the majority of them, right? It's just the one. So what are some of the untoward events characterized in the Institute of Medicine report about medical errors? So wrong site injury, heaven forbid that should ever happen, but yeah. Adverse drug events actually could happen, even though, like we have the smart pumps and we have all these things that try and help us to prevent that from happening, it still can happen. Improper transfusions, restraint-related deaths, so pretty much all of those things would have been that. Okay. When using the principles of virtue ethics and decision-making, a nurse would You're supposed to say, seek ethical community support to enhance character development.
I feel like that was just a weird question.
Yeah, it is kind of weird. So I guess like when you think of someone who is virtuous, you're thinking, oh, they have a lot of character, right? They really, have strong character. So yeah, it's just the wording. I think it's just, yeah. I think I don't know where they get these questions. I'm not sure if these are all like book related or if someone else is I'm not sure what they're doing with these. But yeah, I think that's what they're doing here is they're looking at the word virtue, and that's why they're saying, "Oh, enhanced character development." All right. What else? Okay, nurse manager who makes sure that the staff members who work in a local clinic are competent is demonstrating the public health core function of this is assurance. That assurance is kind of a weird concept to think about, but and maybe I didn't explain it good enough in class, but so assurance is just trying to tell people that yes, you're getting the best care you can because people who are taking care of you are up on the latest everything. They have, this much schooling. You can be sure that you're getting the best care. Okay, God, I can't talk. Community-based nursing care is applied when implementing which nursing intervention?
I was confused on this question too.
Community-based nursing care.
Because I definitely feel like it could go either way.
So let's see what they say down below. So community-based nursing practice is setting specific practice whereby care is provided for families where they live, work, or attend school. The focus is on acute and chronic care and the provision of services. Providing care to families is the only intervention that accurately describes the definition. Let's see. So the other things were assessing the health needs of a defined community, providing care to families in a community, promoting the health of an entire community, investigating environmental health problems in the community. All right, so when it says community-based nursing care, so like investigating environmental health problems in a community, no, I wouldn't pick that because, it's basically saying there's something wrong in the community they're trying to figure out. When you're saying you're giving nursing care, that's not really that. You're trying to investigate what the problem is. So that would be no. Promoting the health of an entire community. Again, what care are you giving? If it just says you're promoting the health of an entire community, that doesn't give me enough of anything. And then you put assessing the health needs of a defined community. Community-based nursing care. I mean, yeah, it's kind of splitting hairs, honestly, because, I feel like providing care to a community, whether it's a family or a group of people or whatever, that's part of giving them care is assessing their health needs. Yeah.
I just looked at like when they said family, it was just like too like I don't know if I just looked into it too much, but I was like, why would they only do families? Like, why can't it be the whole community?
Mhm.
That's just how I looked at that question. Because families, I was like, nah.
Yeah. Yeah, I think that's kind of splitting hairs a little bit there. All right. Let's see what else we got. Okay, so public health nurse is collecting data about biological aspects of community health. What data will the nurse collect? When you're looking at biological aspects, you're going to look at traditional morbidity and mortality rates.
Okay. I think that's just a biological. Threw me off.
Okay. Let's see. What initiative began as a result of resolution adopted by the World Health Organization in 1977?
That one.
So the primary health care movement. Yeah, that some of these are just stupid because why would you ask this? You know, this is like,
Yeah.
so don't worry about that. That's okay. How about this one? Which characteristic has the greatest effect on health?
Wow, that surprises me that that one's wrong. But
Well, I mean, let's think about this. So obesity pretty much affects almost everything that we talk about with health problems, right?
right. And I guess, the health insurance doesn't really affect health. It affects how you're treated, but not your
Yeah.
health really.
Yeah. Yeah, so pretty much you see as you go through all these classes, all the different disorders we talk about, there's everything under the sun has to do with being overweight and everything, that's a huge problem. So that's going to be the obesity for sure. Which of the following is an example of the mission of public health according to the Institute of Medicine? So down here it says to generate organized community and technical knowledge to prevent disease and promote health.
Yeah. I don't know. Some of them confuse me. I actually went to Kent for a while. Well, I
Mhm.
graduated from Kent, but I was getting my degree in public health. So some of these I'm like going back and forth because I'm like remembering things from my other classes, and they both make sense. Like both of those answers are correct.
Yeah, and you know how I feel about these tests. I feel like they're kind of stupid. A lot of the stuff they put on these, and when you go to take your NCLEX is not going to have a stupid question like this on there. It's going to be like more things like, hey, what's primary, secondary, or tertiary prevention or stuff, something like that.
Right.
So it's just, stupid questions most of the time on here. Let's see, which of the following statements about public health is accurate? So it should be changes such as immunizations, tobacco use, blood pressure control, automobile safety have helped increase the health of communities. So your answer should have been historically gains in the health populations have been related to changes in safety, sanitation, and personal behavior, which that kind of makes sense.
Yeah. I hate those.
Okay. Yeah, it's always like one.
Yeah.
So, which of the following are considered barriers to public health nursing? So, few nurses receive graduate level preparation, the concepts and strategies of the disciplines basic to public health. So, that should have been another one. Okay, a community that demonstrates commitment would most likely support the development of.
It was between both of these.
Okay, so when you have commitment, you're going to start some type of program to make things better in the community, right? So, commitment condition of community competence different. Let's see, what's it say? Creating a recycling program as well as associated education enhances both the cognitive and affective domains of the community. So they're looking at two different things that you're doing at the same time.
Yeah.
That's why. Okay. There we go. What are the critical attributes in the definition of community? So it's supposed to be people, place, and functions. Attributes in the definition of community. So when you think of a community, you're thinking of the people who live in it, where they live, and how they function together. Okay, that was all, just those. So again, I think a lot of this is just stupid types of questions that they ask on these, but I want to make sure that you do better on the next test. So what are you doing to get ready for this?
I went over the thing that you sent, like that thing, but I think this time, because I just kind of like copy and pasted it and then wrote like what I found. But I think this time I'm actually going to write it out on note cards so I can flip back and forth so I can physically see the things, because I think that helps me. I am also just terrible at online learning. I always have been.
So you see that this class is like really big into definition and everything. So I would, if you can, I would try to, like, when you're looking at specific chapters and maybe they talk about certain definitions of different things, really focus in on those and make sure you know those well. Because you see a lot of these stupid questions are just simple like that, you know? So make sure you look at that. And then I'm going to try, you know, for this next test to keep sending you guys these like practice questions and stuff. Who knows, maybe that might help a little bit too, you know, for you getting down certain concepts. Did you know that we have a nursing tutor, right?
Mm-mm.
Well, I'm going to give you her email so you can talk to her, because this is some lady, she just started this term.
Okay.
And she only has, I think she does 20 hours a week. So she's not like a 40-hour-a-week person. So she only has specific hours. But if you email her and tell her like what you're having trouble with, she might be able to help you a little bit. Her name is Barbara Wilson. See if I can find her. Here we go. So her email, let's see if I can stick it in here so you see it. Here we go. I think that's her email right there.
B.A. Wilson.
Yeah. She, I guess, used to work at Walsh. And she has some kind of special certification in like teaching, or I don't know how to explain it. Like she knows how to give you different teaching strategies and stuff. She's pretty good about stuff. So she seemed really nice. I met her briefly, but she might be able to help you. You never know.
Yeah, I'll give her an email.
All right, so let me pull up the other one real quick and we'll go over that. Do you think that was part of it too, because you have 2 tests on the same day?
Yeah. But I know that doesn't happen again.
Good.
But yes.
Yeah, I figured, because in some of my other groups of students, that usually is a big deal. They always flip out about that. Sometimes it just can't be helped though.
Yeah.
Let's see, where is it? Or actually, let me see if I can bring you up. Can you see this?
Yeah.
Okay. All right, so this is OB, so let's look at this real fast. So you did pretty good in the first part. And look at that, with that select all, you got those right. Okay, so number 5. So a woman in the 34th week of pregnancy reports she is very uncomfortable because of heartburn. Which recommendations would be appropriate for this client? So avoid fatty or greasy foods, eats 5 small meals a day. And then the one that you missed was avoid drinking fluids at mealtime. So pretty much anyone with heartburn can do any of these things. It's not specific just to pregnancy, but those things would be, you know, helping you to kind of avoid that from happening. So a lot of times they say like people eat too fast and they eat like big volumes of food all at one time. So if you eat like spread out throughout the day, like little bits at a time, like 6 times a day instead of 3 times, or, you know, there's a lot of different things you could do for that. So that's that one. This one here, an infertile couple voices concerns to the nurse about assistive reproductive technologies. The nurse agrees that these have created many ethical dilemmas. Which potential questions does the nurse discuss with the couple? So this should have been every one of them being right, which I know that always throws people off because typically when you have a select all, you don't say yes to everything, which I hate that Herzing does that. I think that's so stupid. But when you look at these, it makes sense because when you're talking assistive reproductive technologies, you're thinking like, oh, here's someone who is my surrogate, or hey, here's someone who is my sperm donor, or there's all these different ways that you can get a baby, so all of these things would be kind of an ethical thing, which partner has ownership over the embryos, should a child be told about donors or surrogates, all of these things. Does that make sense?
Yeah.
Okay. All right, and then this one is that GTPAL system. So
For some reason.
this is saying this woman is pregnant for the 4th time. So that's where your 4 comes from.
I think I just clicked the wrong one then.
Oh, okay.
Yeah, definitely.
Because you would have got that right otherwise?
Yeah.
Okay.
Yeah, just right off the bat. Yeah.
Okay. All right, so you got the pica. Okay, here's this one. A pregnant woman's diet consists most entirely of whole grain breads, cereals, fruits, legumes, and vegetables. So she's not having hardly any protein whatsoever. Which dietary requirement is the nurse most concerned about? It's going to be vitamin B12. So someone with vitamin B12 deficiency needs all of that.
So she has vitamin B12 deficiency.
Yes. So
Okay.
because she's not eating, her protein, she's going to be deficient in vitamin B12.
Got it.
All right, down here, this one I was telling to everyone else, you guys are weak in your pharmacology, and pretty much all students are. But I'm just saying, this is something that you should all have had, this question right here. So when you see a med that maybe you're not familiar with, you kind of have to get familiar with like endings of things. So Stadol is an opioid. So if you knew that was an opioid, you probably would have had this right off the bat, right? Because Narcan is your antidote, correct?
Yeah.
You didn't know it was an opioid.
Yeah.
All right. Then here, this one says this person had an epidural for her pain. She's 5 centimeters dilated, 100% effaced. Baby is in vertex position and is engaged. The nurse increases the woman's IV fluids. The nurse reviews her lab values and notes that the hemoglobin is 12, hematocrit is 38, platelets are 67,000, and the white blood cells are 12,000. Which factor would contraindicate an epidural now? So it's going to be her platelet count, this 67,000. This is low. So again, review some lab type stuff, because if you don't know that stuff, that's a big problem right now. So like this isn't really like an OB type question, even though it is, it's not. You could have this in another class and be able to, you know what I mean?
Right, yeah.
All right, and then maternal hypotension is a potential side effect of regional anesthesia and analgesia. What nursing interventions could the nurse use to stabilize the patient and the fetus? So think about when Dr. Silva was with us and talked to us about stuff. So would you want this woman in a supine position?
No.
Typically, we always put her on her left side, right?
Mm-hmm.
And then here it is right here. Place the woman in her lateral position. So that would be her left side. We always do the IV fluids, and then we administer oxygen. Those 3 things are kind of what she was talking to us about. All right, and then we got this about the pap smear. We got that. Okay, here's another one. So I think this is emergency conditions during labor that would require immediate nursing intervention. Like you need to do something quick. So which situations are examples of this? So you got the fetal heart rate pattern that's abnormal, so that's correct. This one was another one. So inadequate uterine relaxation. So if the uterus doesn't relax like it should, then what happens?
The baby doesn't, like, it's crushing.
Well, isn't it, you get bleeding, you get hemorrhage.
Oh. Because in my head, it's like over squeezing it. So it stopped the hemorrhage.
Yeah, it's causing hemorrhage because it's not doing what you want it to do.
Got it.
Then bright red vaginal bleeding, that's always a red flag anytime, because that's saying you have current bleeding that's, new right now. Prolonged second stage of labor, that doesn't mean anything. So that's one you should not have picked.
I picked it because in the clinical, that was like an emergency for one of the patients.
What else was going on in that?
She had a prolonged second. I don't remember off the top of my head.
There's probably something else with it that made it an emergency, but just being in a second stage of labor for a long period of time, that's not an emergency.
Okay.
There's probably something in addition to that made it an emergency, I bet.
Yeah, off the top of my head, I don't remember what else was going on. There's been so much going on.
Yeah, no, I get it. All right, so you got those. How about this one? So the nurse has received a report regarding the client in labor. The woman's last vaginal exam was recorded 3 centimeters, 30%, and -2. So you should say, hey, this person is dilated 3 centimeters. They're effaced 30%. And this is one that a lot of people had a hard time with. It's this last part that tripped people up, this -2. So the -2 meant that it's 2 centimeters above the ischial spine. So a lot of people picked the opposite. That's what tripped people up.
It's above. Okay.
Yeah.
Okay.
Let's see. All right, and then here's the fetal heart rate decelerations. So a nurse providing care for someone with that, which clinical finding might be the cause of a late decel. Do you remember when Dr. Silva was here and she said, she was talking about all those decels and or these different fetal heart rate things. And remember she said, think of like the stages of when the baby comes out.
Yeah,
And what's the last thing that comes out?
placenta.
Placenta, right? So that's what you should think of with this one. Which I thought that was a good thing, good way to remember that.
Yeah.
All right. Okay, here's another one. There are many cases of minimal to absent variability in the fetal heart rate. These would include fetal sleep, administration of pain medicine, and then I guess you were supposed to pick fetal prematurity as well.
Okay.
And this one, a lot of people missed this just because you didn't understand what lunar months meant.
Yeah. I was literally like, what the heck is a lunar month?
Yeah. I almost, when I gave you guys that tips for the test, I almost said something in there about it, and I'm like, because I feel like I'm giving you guys the answers a lot of times when I do those, and I'm trying to be a little bit more general, so I'm not just handing you the answer,
Yeah.
All right, and then how about this one? Did you just click the wrong thing, or did you know this?
Well, I knew it was November.
Okay.
So yeah, the 21st. Because you just add days to that. So yeah.
So you think you clicked the wrong thing?
Because I got it right on the ATI.
Okay. I just want to make sure because that's probably going to be something you'll see a lot of questions like this.
It's also kind of hard to do in your head though.
Yeah, it is. It is. I guess, you can always have scrap paper on any of these tests. So if you have paper in front of you, you could write stuff down if you have to.
Yeah, that's true.
Okay, what else do we got? Okay, this one. All right, so at least 5 factors affect the process of labor and birth. These are easily remembered as the 5 Ps. Which factors are included in this process? So passenger, it should be this one, passageway. This should be one, powers. This
That's-
should not be one, and then this should be one.
Okay. I think I got powers and pressure confused, and then I just forgot passage.
Okay. All right, then things that affect cervical dilation. So strong contractions. This is weird. I don't know why this is correct. I'm not an OB, everyone though, so maybe I'm just not understanding, but cervical scarring, why would that do that? If you had cervical scarring, why would you be dilated? I'll have to look that up. I'm not understanding that very well. Size of the woman is not going to be something that affects how you dilate. And then frequency of contractions, that would. And then the size of the baby would be though, because as the baby's like coming down the birth canal and like pushing, you know, that actually makes sense. If you have a bigger baby, you're going to have like, you're going to dilate a little bit better.
Got it.
All right, you got the breech position. All right, this one, what is this? Okay, so the woman has requested an epidural for her pain. She's 5 centimeters dilated, 100% effaced. Baby's in vertex position and is engaged. You increase the woman's IV fluid. Before the initiation of the epidural, the woman should be informed regarding the disadvantages of epidurals. So what would be some things that would be disadvantages? So your ability to ability to move freely is limited. Hypotension can occur. And then, yeah, this is a weird one, but higher body temperature can occur with this. So like this one was wrong that you chose, and this one should have been a correct one. Okay, and then here's another one about the fetal heart rate stuff. So what's likely a cause of variable or fetal heart rate decelerations? So this is the cord compression.
Is that just something you should know, or do I remember that?
I think just like what she was saying with like how the baby comes out. So early, I'm trying to remember all the names of everything. So it's early fetal heart rate stuff. Really, you don't worry about too much. It's what the 3 that we worry about are late, variable, and what's the other one? I'm missing something.
I don't remember. Late?
I'm drawing a blank at the moment. But yeah, so that whole thing that she was telling us about how the baby comes out, that's how you would remember this.
Okay.
So like what comes out first would be your head, then like the cord would come out next, and then the placenta would come out last.
Yeah.
I think that's how that goes.
Okay.
All right, this one, so which time-based description of a stage of development in pregnancy is correct? So it should have been term pregnancy. So anywhere from 37 to 42 weeks would be term. So even though like 40 is your cutoff, 42, like, you know, you go past that, that's still term. You've cooked your baby as long as you possibly can, and now it's even in longer. And then like a couple weeks before is still okay as well. Like I delivered my daughter 2 weeks early, and she was still considered term.
Okay.
Okay, so positive signs of pregnancy. So we got identification of the heartbeat, visualization of the fetus, verification of fetal movement. This should have been the other one, palpation of fetal outline per Leopold's maneuver. So this one, when you say positive signs of pregnancy, this all has to do specifically with the fetus. Everything that you look at is specific to the fetus. And then with probable signs, these are all things that are kind of things that the healthcare provider can identify. So like there was we had a big list of things when we talked about this in class. Like there's all those different, I'm trying to think of some of the names of those things, but things that the healthcare provider observes specifically. Okay. All right, and then you're taking a history of a Gravida 2 Para 1 patient, which finding in the patient's history warrants further investigation. So this is just saying, like, how we talked about when people first go to the doctor after they find out they're pregnant, and you do a big history with them to get kind of their background and everything. So if you were sitting there with someone and they told you that they had a history of hypertension and all of these things, these would be things that you would want to look further into to make sure that it's not going to be an issue in the future. So anemia, severe hemorrhage, infections, malnutrition, and hypertension, all of them.
Okay.
And then which
Moderate deceleration, that's the
fetal
other
heart rate deceleration would require the nurse to change the maternal position. So, okay, so this was a missed one. So late deceleration, so you would want to do that because that's a more concerning fetal heart rate. Variable, definitely. Moderate decelerations, this was not one, I believe. And then prolonged decelerations. All right, and then you got the last one.
Cool.
So for this one, what did you do to get ready for this one? Did you do
I
anything
didn't do anything different than the other one, so something's
Okay.
got to.
Yeah, we got to start doing something different so you guys can get a hold of this stuff a little bit better.
How was difficult?
What's that?
Yeah, the test was difficult.
Yeah. Well, I mean, I think this one was like the questions, at least, I think are a little bit more doable on this compared to the community. The questions are stupid.
Yeah.
Now, the ladies that wrote this test are actual, like, maternal health nurses, so they know what they're talking about. So I think these are all pretty decent questions. Like all of the questions I'm looking at so far on these particular tests, I think are pretty good. So something maybe I can do to help you guys, I'm going to see if I can send you some practice questions here and there, and maybe that would help you a little bit with stuff.
Yeah.
What I would do, like, I'm thinking to myself, if I were a student trying to learn this stuff right now, I would try to print out the PowerPoints ahead of time if you can, and then just go through the chapter in your book and take notes on the PowerPoints. And then when you have class, when I'm talking, if I say anything else that maybe you missed or you didn't write down, you can put it in there, after you have already made your own notes.
Yeah.
That's kind of how I would look at it, maybe.
Okay.
Because that's kind of what I'm doing. Like, this is my first time around teaching this. So what I'm doing, like, I'm taking a lot of time doing this. It sucks because that's all I did the last 2 days to get ready for these 2 classes is take notes on everything, because I'm doing it weekly because I can't keep up with it all, So I print out the stuff, I go through the chapter, I take notes on things, put it on my stuff. That's how I do it. So what I would do, I wanted to make sure I gave you that lady's email because I want to identify this quickly and get you help quick if I can. I don't want to wait to get you, too out of control with your grade.
Right.
So, you have an issue with both classes, so we want to make sure we get you back on track. So again, like what I was saying with OB, really make sure that you are paying attention to this proctored exam. That's really important. So really spend some time, do lots of questions on that. Look through your ATI book and see if you can, get a better understanding of certain things as you're reading through that. Okay?
Mm-hmm. Sounds good.
Okay. All right, thanks for staying. Hopefully I didn't keep you too long.
Oh, thanks for helping me. I appreciate it.
Okay. All right, have a good rest of the afternoon.
Thank you.
Thanks.